So my name's James Charlesworth. I'm a paediatric trainee in the Oxford Deanery, and this study arose obviously 18 months ago during the first COVID-19 lockdown. And I was interested that obviously we saw globally massive reductions in children coming into the emergency department and admitted to hospital. And I was interested to see if we could work out who were the children that were missing from secondary care based on discharge summaries and discharge diagnoses. So I'm afraid we have to cast our minds back for this 18 months ago for the horrors that were the sort of stay at home, stay alert, all this business. But actually this was an unusual lockdown, and obviously we've had subsequent lockdowns since which have been less strict. So this first lockdown, if you'll remember, the roads were clear and we were having quite a nice commute actually, if anyone was still commuting at that stage. So I'll just quickly run over what that lockdown was as it's relevant to the data. So at the start of March, there were only 36 known cases of COVID, and the first COVID death occurred on the 5th of March. And then shortly after, on the 16th of March, was when the advice changed to no non-essential travel. And so I've called this the sort of amber period where COVID restrictions came into being. And then by the 20th of March, schools were shut. Exams were cancelled for the summer, and as you can see, I've sort of put the deaths and the cases on here in various places. You can see obviously it's the exponential growth, and that was the point the announcement was made that by the 23rd of March there would be a national lockdown, a stay-at-home order was announced, and that would stay in place until the 13th of May, so full 7 weeks of lockdown, which was taken fairly strictly, as I showed on the previous slide. And after that period, that's when we moved to the stay alert system, and the tiered system came into being shortly after. And so this was when Test and Trace was commissioned by the end of June. And so there were still COVID restrictions in place. So I've sort of coded that amber as well. And so this red period is the strict lockdown that I'm mostly looking at. So this slide shows international data demonstrating a reduction of ED attendances for children and inpatient admissions. And so this was reported during the lockdown and shortly after the lockdown, and this was true internationally, so Italy there, Canada, Ireland and the United States, all showing based on historical years, and there's 3 years shown here for the United States in Philadelphia, and the 2020 year you see a dramatic reduction in children attending the emergency department and then subsequently being admitted to hospital. And this was also reported in the bottom right here in the United Kingdom. I think this study looked in Manchester. This was in a regional hospital and a district general hospital, and both showed dramatic reductions in children attending paediatric departments even prior to the formal lockdown, and then that was maintained in lockdown. So my research question, which I conducted in the form of an audit, was really to say, could we identify which children were missing from secondary care, in inverted commas, based on previous years' diagnoses? So which diagnoses were not made during the lockdown period? So the study design was a retrospective cohort study across 2 hospitals in Oxford. So that's the main hospital in the centre of Oxford, and the District General Hospital in Banbury in North Oxfordshire. And we looked at all children under 16 years of age, both attending the emergency department and admitted in the 3 weeks prior to lockdown, across lockdown, and in the 2 weeks following lockdown. And I compared that to 5 historical years, so between 2019 and 2015, using match dates, including the same number of weekends and weekdays. And we had data on the age of admission or the age of attendance at ED, whether those ED attendances were translated to admissions and the subsequent length of stay of patients admitted to hospital. And crucially, we had all of the diagnoses, the ICD-10 diagnoses that were coded for patients discharged during the lockdown period, and they were up to 10 diagnoses per patient. So we found that in terms of the absolute numbers of children attending, there were reductions up to 60% of ED attendances, and similar reductions in inpatient admissions during that period based on the historical 5 years. So taking an average across the 5 years, there were nearly 60% reductions of patients coming to ED and coming into hospital. And there were 22,000 or more than 22,000 diagnoses for me to sift through to work out which of those were significantly reduced. And for ease, I also divided them into chapter headings. We used sub-chapter headings as well in case they were slightly divergent in terms of the specific diagnoses. But actually, in the end, the individual diagnoses were fairly consistent across the years. So this is showing graphically those reductions in individual attendances. So the grey line here is the previous 5 years, 2019 to 2020. And the purple line here is a reduction in ED attendances, and you can see it reduces before the lockdown period starts, maintained throughout the lockdown period, and maintained after lockdown. So compared to now, we can see a significant reduction due to COVID. And I was looking at any surrogate measure for whether this was patients who were just more unwell who had to come in, and the weller children stayed at home and they were looked after by their parents. But actually the case mix seems similar in that the similar proportion of patients who were admitted throughout that period in 2020 compared to the previous 5 years. So it's about 20% of patients from ED were admitted. In terms of attendances here, it's a very similar story. So that reduction starts just before the lockdown, the formal lockdown, as the restrictions come in, and is maintained throughout lockdown. And again, I was looking for surrogates of severity of disease. So I looked at the length of stay, the subsequent length of stay for patients admitted on each of those days. And it was very similar. So there was a similar length of stay on average across the lockdown period for patients admitted during lockdown compared to the previous 5 years. However, I did find that there were more patients, so individual patients had more diagnoses. So there were more patients with more than 2 diagnoses, but actually at every stage there were patients with more diagnoses. There seemed to be a particular peak at 2 diagnoses. So 40% over the last 5 years had a couple of diagnoses, less than 2 diagnoses, whereas 60% during that lockdown period have more than 2 diagnoses. And I've sort of, I think I've probably explained that, and unfortunately it's a benign diagnosis. So this here looks at the significant reductions in the main ICD-10 chapter headings. So you can see here that the respiratory diseases were the main reduction, along with infectious diseases. And as I say, individual patients can have multiple diagnoses. So it may be that they had an infectious disease diagnosis and a respiratory diagnosis. And we also found that there were reductions in abnormal clinical findings, injuries, and external causes of injuries. And this external cause of morbidity is things like being hit by a car. And we assume that's because children were more indoors, they weren't walking to school. And musculoskeletal diseases were significantly reduced. There were significant increases in some diseases, and this is factors affecting health status. And that tends to be recording comorbidities, essentially. So this is probably more of a recording difference than it is unwell children. So this is things like recording that child has an innocent murmur, or a family history of type 2 diabetes, or a personal history of allergy, rather than the primary diagnosis or the disease itself. But interestingly, there was also a significant increase in neoplasms, so oncological diagnoses made during the lockdown period. So I've tried to show here across the period what were the diagnoses that were missing. So these were the normal number of diagnoses, and as I say, the diagnoses were greater per child. So there's actually not the same reduction in children as there were, reduction in diagnoses as there were children during 2020. So these are the missing diagnoses. These are the diagnoses that were significantly reduced, and I've then categorized them in the lockdown period. But also we had significantly increased diagnoses. So firstly, the significantly increased diagnoses fall into a group of other diagnoses which just sort of bunch together, and there tend to be things that are recorded 2 or 3 times in the lockdown period that were rarely recorded previously. But then there's also a significant group of recording pandemic screening. So this is things like observing for COVID or screening for COVID. And that explains some of those increases in diagnoses. And lastly, it's recording incidental findings and comorbidities, which I thought was interesting and may reflect that junior doctors have more time to make those observations and record in more detail what's going on with these children. The missing diagnoses were predominantly infectious diseases. So this is by categorizing individual diagnoses into those groups rather than using the chapter headings. And then I also had a group which were sequelae of infectious diseases. So this is essentially bronchiolitis, wheezers, so children that come in with diseases that are a result of infectious diseases. So 80% of the children or the diagnoses missing during lockdown were due to infectious diseases. And the final two categories were both about 10% each, and they were accidental injuries and poisonings, or non-specific aches, malaise, and pains. And I wonder if those were just so sort of subtle that parents were happy to keep those children at home and observe more closely. And of course, they're also working at home. So in summary, and I'm happy to answer questions in a second, we showed that missing children were mostly missing due to infectious diseases, and probably this is a result of the lockdown control measures, which is intended to reduce infectious diseases. And obviously, it was intended to reduce COVID-19, but we know that it reduced the spread of childhood respiratory diseases, and we're now seeing the result of that at the moment. But we also obviously reduced the sequelae of those, the wheezers and the bronchiolitics. But we also saw a significant reduction in accidental injuries presenting to hospital and non-specific complaints, things like headaches. We did not show significantly more unwell children, although that may have been missed in this data. And we also didn't show more safeguarding cases, although again, that's something that's not particularly well coded. And I know other places saw reductions in safeguarding referrals, and there was a concern that that would be missed due to lockdown. But surprisingly, we did see an increase in oncological diagnoses. Maybe that's due to the referral pathways changing. But this is something that's been replicated in a study in Germany as well. So they saw a very similar finding to ours. And lastly, we just saw an increase in recording incidental findings and comorbidities. So we did actually publish this data back in May, showing similar to other people that we had a change in the case mix. So I'm very grateful to the people that helped me while I was in Banbury to collect this data and encourage me to do the study. So I'm happy to take any questions if there are any.
Thank you very much, James. Very informative talk. We've got a couple of questions here. Did you make any conclusions regarding the presentation or admissions due to mental health diagnoses?
We saw significant reductions in mental health diagnoses, but we're probably not looking at long enough term data, I suspect. So we're only looking across that lockdown period. And so what we saw were significant reductions in eating disorder admissions. One of the interesting things that were, I don't know if I'm able to move this across. One of the interesting things that were increased, and the greatest increase, was increase in psychotherapy not otherwise classified for some reason. And so that increased, there were 12 diagnoses made in that period that were never previously made. But these are the sort of other diagnoses that cropped up. But mostly in terms of mental health diagnoses, we saw significant reductions. I don't know if that's somewhere around here. So intentional self-harm was significantly reduced. There were no recorded self-harm injuries during those 7 weeks. I suspect they all occurred later on. And we know, I think, from other publications that this was something that was waiting in the wings.
Thank you. And another question, do you think the increase in oncology diagnosis was because the haystack was smaller, so it was easier to find the needle?
Yes, yeah, no, I think that's a really interesting idea, that we could see the forest through the trees, and that that we're able to focus better on the children. And I think that's one of the reasons I was interested to see that we're recording more comorbidities, and we're possibly making better diagnoses, and we're paying more attention to the children when we're not having to wade through the febrile children that are otherwise well, and the mild gastroenteritis. So I think that may well be the case. It's hard to say whether referral pathways changed and GPs found it harder to access oncology services through other routes, and so these children were sent to ED or were sent as inpatients otherwise. So I don't know, but I think that would be a really interesting hypothesis. Thank
you. And difficult to reduce infectious illnesses with increased mixing. Do you think there are any lessons to learn from other reductions, for example, accidents, that could be used to help reduce this in the future?
Oh gosh. I don't know if we can extrapolate so largely. I mean, we had lots of reasons that it may reduce accidents. Obviously, playgrounds were closed, and ICD-10 codes literally everything. So you can see when they were injured on a swing or or a roundabout. So we saw all of those playground injuries disappear. I mean, one theory is that parents were at home, so they are able to monitor children more closely. So there may have been children with febrile illnesses, or they may have had these respiratory illnesses. They just might have been more closely monitored, and parents were happy to do that. Or there was anxiety about bringing them into hospital where they might have been exposed to COVID. So it may be a combination of willing to monitor versus the anxiety about hospital attendance.
Thank you. And one last question. What can we take from this, and should we be doing this with chronic illnesses every year?
The lockdown.
No, the identifying the missing children.
Oh yeah, it'd be great. Yeah, no, I love data. I think that would be fantastic. I don't know why we don't delve into the data a bit more. That would be great.